Hi everyone, welcome to researchmd.com. We got another great presentation today. Today we're going to teach you all about tension headache, another important headache. We made presentations on migraine headache. Please watch our previous video on cluster headache. Today, tension headache, under 9 minutes, my friend. Very, very important to repeat, in order to remember more frequently, or it's important to watch the videos like 2 to 3 times. There's no point in watching like a 60-minute video or like an hour or 1 hour and a half. If you don't have the time to repeat it. That's why we make all our presentation under 9 minutes, okay? So let's get into our topic is again, tension headache. My name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and medical residents. I'm also director of research and I'm an assistant professor of medicine, 2 major medical schools. So when you talk about tension headache, right, I think the main description is very, very important. What do they usually like? It's a band type of pain, right? It's a dull pressure, fullness of the head feels large, and heavy weight on my head and shoulders. Those are the most common characteristics when they talk about tension type of headache, okay? Epidemiology, if you look at it, there's like this episodic and chronic tension headache, that's like 38.3 and 22%. Prevalence of episodic tension headache peaks in the 4th decade, and the females greater than male. I mean, make sure you always know the difference. Most of the headaches are in female, right? Men, the main type of headache more common in the cluster headache is very common in male. So when somebody, if you see a question or if you're taking a test, if somebody write a question like a 45-year-old male patient come with a headache, first thing you should come is a cluster headache they're talking about, okay? So again, I'm just kind of in this, like tension headache, females is more, and let's get into the pathophysiology a little bit. There's heightened sensitivity of the pain pathways in the central nervous system, and perhaps a little bit of the peripheral nervous system is also involved. Increased muscle tenderness is the most pronounced and consistent finding, okay? And then you got nociceptors around the blood vessels and striated muscles, tendon insertions, and fascia. And that would be also like a source of pain. And nitric oxide of the molecular trigger for pain also, okay? Now, diagnostic criteria, ICHD, that's the international classification. Let's look at the episodic tension type of headache require at least 10 episodes of headache, each lasting like 30 minutes to 7 days, which fulfill the following condition. At least 2 of the following, like bilateral location, pressing or tightening quality, mild or moderate intensity, okay? And then general and neurological examination are normal in this patient, okay? In attention to temporal pattern of the headache is necessary to distinguish tension type of headache from the secondary headache. Now, classification, again, 3 main subtypes of tension type of headache. One is called infrequent episodic tension headache. What is that? Headache less than 1 day a month, okay? Then you got frequent episodic tension headache. The headache is 1 to 14 days a month. And then you got chronic tension type of headache with the headache greater than 15 days a month. We got a nice table up here looking at the difference between the episodic tension headache and a chronic tension headache. Look at the episodic tension, at least 10 episodes occur in 1 to 14 days per month for more than 3 months, fulfilling the criteria B to D. Okay, and then if you look at the chronic, occurring on greater than 15 days per month for 3 months, fulfilling the criteria B to D, and the lasting 30 minutes to 7 days, and the other one lasts hours to days. Headache has at least 2 of the following location: bilateral location, pressing, lightening, and the other one is also, tightening, not aggravated by routine activity. Again, that's the same in both of the following: no nausea, vomiting, no more than 1 photophobia, and phonophobia, not better account for another ICHD3 diagnosis, okay? So there's a major difference, kind of go through this episodic versus chronic tension headache right there. And then evaluation, when do you do imaging? Most of the headache you should not pick as an imaging because it's chronic headache, like your migraine, tension. But if you're suspecting any type of red flags, like we'll talk about what are the red flags. Let's say pain waking the patient up at night, history of malignancy, severe thunderclap headache, or like fever associated with the neck pain. Those are the red flags. Then you have to do the imaging, okay? Otherwise, there's no role for imaging studies in headache. The routinely is not recommended, but mainly you're doing to make sure there's nothing else severely kind of going on, but there will be red flags for you. Diagnostic challenge occur in the evaluation of suspected tension type of headache when older adults are available. It's a problem. There are atypical presentation. They can have like absent features. Some of the the classic features which we talk about may be absent in these people, right? And some of the symptoms may be kind of like that is common with tension. It can like overlap with the other type of headache, and when sometimes it's very hard to get the history out of the patient. They might report all the symptoms to you. That is the diagnostic challenge we usually face. Treatment, let's look at the treatment. What are you doing in the treatment of infrequent and acute episode? You got ibuprofen 400 mg available. You get acetaminophen, aspirin with caffeine, acetaminophen with caffeine, buterbital, and isomethaptine. All of this could be used. Okay, treatment when you have a chronic tension headache. Treatment goal is to initiate effective prophylactic treatment and to manage any residual headache in a manner that prevents the frequent use of analgesics, okay, and the risk of progression to chronic daily headache syndrome, which is caused by the analgesic. So you can use this type. You can amitriptyline 10 to 750 milligram at bedtime. SSRI, venlafaxine, smoking cessation reduction you could use. Now, there's a lot of other non-medication treatment, which will make another presentation on it. Biofeedback is relaxation training, self-hypnosis, cognitive therapy. Always pay very good attention. Biofeedback is an excellent tool to treat tension headache. Okay. Thank you so much for watching. Please subscribe to our channel. Click the like button. We'll be back with another presentation soon. Thank you.